Okay, for this video, we're gonna be talking about trying to create some space in the hip and the low back. I'll be doing it on both sides, so I'll be going back and forth. But if you have a hip issue or a low back issue or both, which is oftentimes the case, tightness, stiffness, and ultimately pain from excessive compression is a major problem and an ongoing one. It's very hard to just do stretches and strengthening things without falling into that compression. So this is really like a stretch in the sense of decompression, which is really what provides a lot of relief to joints as well as chronically tight muscles. It helps to stimulate them to relax or trigger the relax of the muscles versus a traditional stretch. So let's give that a go. So I'm gonna do this in lying, sitting, standing, and then with a step, which I find to be very helpful to get the leverage, especially if you're having difficulty donning socks or shoes or something like that. So we're gonna start in lying down, and I'm gonna be on my back, and you can see that. I'm gonna have the heel of my hand. I'll show you this better when I'm sitting, but it's like your thumb wants to be right on the crease along the groin, and the heel of your hand right in the middle of your femur there, close as you can to your hip, which is right towards the groin there. So palms are on the upper thighs. And so what I'm gonna do is I'm gonna kind of leverage and press there. And I can do both sides, and if I keep my ribs anchored and I keep my back kind of flat, I can kind of really feel that stretch through my back more. Or I can kind of go unilaterally. If you're flexible enough to reach across, you can do this, or you can use like a yoga block, and that will get you so you get both hands on there without having to reach too far, like lift your head up, things like that. And it gives you that direct pressure because it's rather firm without being overly hard. And so we're just trying to drive that hip kind of down towards my feet here, maybe out a little bit if you can. That's where having the other hand available will be helpful to get more of that outward drive to kind of distract in that direction. But again, if you're going more straight down, you might find that that's more of a back alleviator. If you're going down and out, maybe more specific to the hip. If you're able to get your leg up, or maybe you can use a strap here, maybe hold it with one hand or hold it with this hand and drive here. What I want here is the leverage. I'm pulling my knee towards my chest, and I'm leveraging more proximally here at the groin, leveraging that hip. Imagine the ball in the socket there. Obviously, this is not going to dislocate your hip or anything like that unless you just recently had a hip replacement surgery or something like that. But generally, the hip is a very stable structure, and we're talking about millimeters here. It's not going to be moving a whole lot, but it's the sense of decompression and the relief that can provide. So I'm just kind of working into here and kind of mobilizing, stretching. You want to feel that stretch. You want to feel that good, stretch feeling, but it's not going to feel very intense. It shouldn't anyway. It should just feel kind of alleviating and kind of working here. And if I'm able to, I can progressively bring that leg up, maybe trying to get the knee up and across if it's tolerable. And keep in mind too that if that's really jammed up, it will be uncomfortable if you be pinching in that groin. So part of this is to be able to bring the knee up and leverage that hip out so you're not pinching in there. That's really helpful to be able to get that leg up and get your sock, shoe on, things like that. So now we're gonna come into sitting, and I'm gonna come down to this chair here. So I'm here, and I'll just switch over to my left so you can see better. But again, I can reach across here, maybe use a strap or something if I'm not mobile enough to get across there. I want to try to use my body weight now. So I'm coming down and over, and I'm trying to get that hand down and out. Now I can switch, I can try to come over this way. That might be a little bit better if I can get that angle. But you can play around with that and see what works best for you. But ultimately, you're trying to get your weight up and over, keep your spine straight, and try to leverage that hip out while you bring the knee up and in towards closer to you. I can do the same thing in standing. I can do it like this as I load, okay? I can do it kind of like that, keeping my back straight, okay? I can do it in stride, so like a lunge, same thing. So I don't want my knee to buckle in. The idea is just to stabilize it so I can get my body over it without it either going too far in or too far out, and kind of drive that hip right more straight back. And then lastly, on a step, same thing. I can kind of leverage here, use my leg for support, or if you may need to use a railing or something, but it's ideal if you can get both hands on there, and I can kind of mix and match and see what works best depending on how well I get my hand in here and what kind of leverage and how much relief that provides. And that's pretty much it.